Everybody can hear me?
Om Shanti.
Om Shanti dear. Let's start the session. Come into the sitting posture. Keep your back, neck straight, align, relax. And gently close your eyes. Keep your back, neck straight. Bring the alignment. Go into your posture. Now very slowly move your attention towards inhalation and exhalation. How the breath going in and coming out. Observe attentively, carefully. Now, take a deep, prolonged, slow inhalation. Deep, prolonged, slow exhalation.
Как будем делать экзамен по аюрведе, вообще без понятия. Так дает.
Now, inhale for the Om. Take a deep breath.
Ты уже прям так это. Full packed. На низком старте.
Shanti, Shanti, Shanti. Feel the vibration and sensation. Join your both palms. Tap your palms. Place on your eyes. Feel the warmness. Very slowly while blinking, looking at your palm. Gently open up your eyes with a great smile. Om Shanti. Welcome to the yoga therapy class. Just give me 1 second. So yesterday we discussed about the yoga therapy 5 pillars and 3 perspectives. And also we talked about it the principle of the yoga therapy, which you wrote it down, right? So now we're going to explain one by one. The first one, you already noted down, right? So today I'm going to explain about it. So very first principle, that is a Yukta Siksha. The pronunciation is Yukta Siksha. So Yukta Siksha means, Yukta means appropriate. Siksha means teaching. So one should get the proper teaching of the yoga therapy. The yoga therapist should know the, having the understanding about the Ayurveda also and the yoga also. Many Ayurvedic doctors, they don't have the very, depth knowledge of the yoga. And many yoga practitioners, they don't know about anything, the Ayurveda. But here the yoga therapists know the both of them. Ayurveda plus the yoga. So yukta, appropriate siksha, appropriate teaching, appropriate knowledge one should have in order to, implement on himself or spreading this information or helping the other people. So he should have the yukta siksha, proper teaching, proper learning. Second is a bhed. So bhed means here the differences between the individual. As I keep talking about it, even in the many previous session, I talked about it, that how the Ayurveda talks about it, the individualization, like individual approach. So if you get the treatment, especially in Ayurveda or in any, especially in yoga therapy, the yoga therapist, gonna apply the individual treatment, like the treatment which is suitable for you. And that's why he required the 4 to 5 months to, keep under the observation the patient, and then evaluating how, when they are doing certain therapy, what is the outcome and what is the result. So bhed, they are applying the treatment on the basis of the differences between each one. Because they're psychic, they're physical, they're mental, they're emotional, approach is totally different. You are different from the other person because your notion is different, your perception is different, and so your illness is different. Though there's a general, on the if you see on the superficial level, everything is look very common. Okay, we all are human, but still we have certain problems. Why? Because of the certain problems in our psychic. We are suffering from the psychological disorder, and in the root cause, we are looking for the root cause, and then yoga therapist work on the bhed differences and then apply the treatment accordingly. So this is the second one. The third one is a desha. The desha means the place and the country. Place and the country, it means the country, which country a person belongs, or which continent the person belongs, the atmosphere, which kind of atmosphere one person belongs. Remember, I talked about it, the three dosha is not only the prevalent in your body, but the outside environment also. And also you have the certain kind of different, different climate, different, food, different vegetables, different fruits. And so that effect on your body is totally different. Even the water play a very important role. Even the straight, when you cross the straight water is keep on changing. One straight having the different kind of water, another straight having the different kind of water, and country water is completely changed. That's gonna affect your body, your structure also, and your food also. Whatever food you are taking, your water also affected by that. So a yoga therapist should know about it. That, for example, if I'm gonna treat any European, person or any African person, so I have to keep in my mind that their skin color, their approach, their culture, their food is totally different from the Indian continent. The spices, whatever spices they are using, it's totally different from the Indian continent. And keep in my mind, I have to use the treatment accordingly. So next is the Dehe. Dehe, the fourth one, the bodily constitution, Dehe. So what kind of body type one person having? That one has to know. You have what kind of body type? You are having the, tall, medium, or short body type, small frame or broad frame of your body structure. You have to consider that thing. So by evaluating the body frame, you also evaluate the three dosha also. Little bit idea you get about it, which we talked about it in detail. So that knowledge the yoga therapist should have. Then Kal. The Kal means here the time, year, and season. The Kala play very important role. So Kala means here what kind of time one person having the problems. And I also talked about it in detail that the season and the time, the winter time, the summer time, the rainy time, having the different Vata, Pitta, and Kapha problems aggravated during the different season, time, day, or night time. We already talked about it. That also you keep in your mind, and accordingly you provide the treatment. For example, morning time is a kapha time, and one person who is living in the cold climate, the winter climate, so his kapha is more dominant than the person who is living in the summer climate or coastal area. So you have to, keep in these things in your mind, and accordingly you have to provide the treatment. Then next is the sixth, the vritti. The vritti means occupation here. Vritti here means occupation. What kind of business, what kind of work your patient, your students, or whatever to whom you're gonna, provide your treatment. You should know what kind of occupation he's having it, and accordingly you're gonna provide the treatment. For example, a teacher have the different, completely different treatment comparatively to the person who is doing the day-to-day activity, the wrestler or the um, some person who is in the gym profession, or Pilates teachers, or any other form of the teacher, or homemaker or housewife, and the working lady, totally different occupation they are having. And so their treatment would be different because you have to make the routine accordingly. A person who is sitting for longer period of time doing the desk job, his treatment is different from the person who is very active in the sports. So you have to keep in this thing in your mind, and then you provide your routine. You make your routine accordingly. So vritti, you should know about it. The yoga therapy should know about it. Then seventh is the Shakti. The Shakti is the capacity. This is most important thing. Shakti, the capacity of the person, is he able to practice all the routine, whatever you are giving to him or her, or you are wasting your time and she and he gonna waste his and her time. So you should know about it. They have the capability or not. A wrestler, a person who is they or in the sport, they can do the very good asanas, they can do the very hardcore practice. But person who's sitting on the desk job and require lots of mental tasks, he may be not able to fulfill your whole the routine. So initial level, when you're preparing the routine for them and providing the diet for them, you have to keep certain thing in your mind. Are they capable of doing perform all the things whatever you are gonna tell them? So these things you should know about it. Then 8 is the mark. The mark is direction. What kind of mark you're gonna choose for making the treatment? The mark here also mean, for example, a person who is a high in pitta, right? The pitta is very much dominant. He is very active, physical and mental level, and doing the desktop job, sitting on the for longer period of time, eating lots of time, and develop the hyperacidity. So what kind of mark you're gonna provide? How you're gonna provide? Like devotional mark. You're gonna provide him the bhakti mark, active mark, where he can, make himself active and connect himself. He cannot be sit. He feels so bored about it. So initial level, you have to introduce the devotional mark to him, the bhakti mark for him, where he can do the chanting, where he can do the kirtan, where he can do the little bit dancing. Dancing, by doing the dancing, he can release the, do the more act which he loves it, the activity, and then he go into the attain the peace through the devotional mark. Attain the peace and the calmness through by practicing the kirtan and bhajan or chanting the mantra. So that kind of mark we are talking about. When you evaluate that the person having what kind of occupation, what kind of personality they are having it, then you have to choose the treatment accordingly. So very individual approach you have to apply here. And it requires lots of study. It's not like, okay, now after 1-2 months, you become yoga therapist. No, it's difficult. It required many, many years to develop the understanding of the small, small things. All the food you have to know about it. All the, things you have to know about. Small, even spices. There's a detailed, research on the each spices. So it's too much work. Even whole life, if you wanna study, still you cannot complete it. So that much research you required, and it required the many, many years of the practice to understand the personality, to understand the persona and their attributes, their quality, their psychic. And yoga therapists, yes, certainly they become the psychiatrist also, because they have to understand their mind. Without, if the yoga therapy does not connect with the mind of the patient, it's very difficult to sort out the problem, because the approach of the yoga therapist is to take the problems from the root, and the root is generated where? In your mind. All the problems start from your mind. So it's very much important that you have to consider these 8 principles, and then you can, but I know it's very difficult, but slowly, gradually, you at least, whatever I talked about the Ayurveda, that you can implement to everyone. This much is clear to everyone. Any doubt?
आपने जो अभी मार्ग बताए ना, हेलो,
हाँ हाँ, जागृति, मार्ग बताया।
उसमें अगेन किस टाइप के कितने कौन कौन से मार्ग है वो आगे आएगा क्या?
नहीं, वो आपकी फिलॉसफी में होगा। योग मार्ग, जितने टाइप्स के मार्ग होंगे योग में, तो आप फिलॉसफी में आप पूछ लेना, बट सिंपल है, जितनी फॉर्म्स हैं वो सारे मार्ग हैं हमारे पास। एशियन टाइम में 4 मार्ग थे योग के, राजयोग, राइट, Nad yoga. There is many types of the form, many forms of the yoga, even very much popular in the Asian time also. And nowadays also we are having the new forms of the yoga also. So you can choose, but yes, mostly, especially the yoga therapist, always take the half of the things from the traditional yoga and half of the things he modified accordingly to the requirement of the patient and the interest of the patient. For example, aerial yoga is not mentioned in the ancient times, but if there's a many patient who are practicing the aerial yoga, but they showing the interest. So 1-2 posture, yes, yoga therapist is gonna understand this thing and he tell them accordingly that what kind of asana you can use, what kind of posture you can use when even you are performing the aerial yoga. That is the modification version he implemented. Okay.
Thank you.
Clear, Jagriti?
Yeah, thank you.
Did we discuss Veda today? Veda.
What?
Veda. One of the 8 principles, Veda. I think maybe I have missed it. Can you repeat our Veda?
Bhed is the difference between individuals. Why you are you? Onkar, why you consider you are different from the other? That's bhed is known by the yoga therapist. And that according that bhed, that difference is the yoga therapist gonna, apply the treatment. I am the different from the rest of the females. You are the different from the rest of the male generation, right? So what makes you different? That is the yoga therapist try to understand these things and then he try to implement these. So this is why you are you. Because of that, you have certain problems also and certain plus point also. But yes, there's a many problems coming out because you are you. So yoga therapy is gonna try to figure out these things and then try to implement the treatment accordingly. That is the bhed in here, the 8 principles.
Okay, thank you.
So now these things are clear to everyone. Now write it down. The problems which we're gonna talk about it. The osteoporosis. Write it down. Osteoporosis, arthritis. Arthritis and osteoporosis, the problems related to this, and back related issues also you can write it down, because major back related issues come when you have, and this I should write it down. These problems you're gonna, I'll try to cover today or maybe tomorrow. Osteoporosis. Arthritis. Back problems. Write it down these problems. We try to find out the cure of provide. I'll give you the therapy of these problems. But again, generalized therapy, because as I keep saying it, to apply the individual approach, you require the detailed study of that person, require the one-one session, and you have to go deeper level of that. It's like more, understanding the psychology of that person, and then you have to implement the treatment. But yes, there's a general treatment also. So we're gonna learn about the general treatment. So the problem related to the osteoporosis and the arthritis or rheumatoid arthritis, osteoarthritis, and disc herniated issues or back related problems. These are the problems which mostly generated by the VAT problems. Remember, I talked about it. When VAT is increased in your body, you get the problems in your bones, in your joints. So osteoporosis is the one kind of, I'll explain you. Osteoporosis, it means like your bones become brittle and thinning. You have the thickness of the bone like this, and then after age of the 30, because of the you are going towards the old age, then your bones regeneration become a bit less, and degeneration of the bones become on the peak. This is the procedure. Okay, so regeneration on the bones when you are growing, when you are baby, is very high, right? You are growing from the how you become the child. Why is it not clear? Now this is good.
Yeah, better.
Jagriti.
Better.
Okay. So bones related issues, especially the osteoporosis, when you're growing, like your tiny baby now, you have the soft bone. Now see yourself, you are huge structure, you are having it very hard, strong bone. Now you are having it. Why you are having this structure? Because bones are the living being, is very alive cells. They are not dead cells, because every microseconds the bone is keep on changing. The cells of the bones are keep on changing. And what going on in your bones? It's growing in the child. It's growing very fast. Regeneration of the bones is happening day to day. But when you cross the age of the 30, this procedure slow down, and now the bone degeneration start happening. Daily you have these procedures going on in your body. The cells are coming, new cells are coming up, and the old cells are dying. This is the procedure keep going on. But when you reach to the old age, what happened? This procedure goes slow down, and degeneration of the cells going on the fast mode. Why it going on the fast mode? There's so many reasons. Yes, we're going to talk about later on. But what happened in osteoporosis? These things happen on the very fast mode due to the sanitary lifestyle, due to the lack of the exercise, due to the lots of stress, especially the females. After the menopause, their hormones are gonna imbalance, and because of the PCOD, thyroid issues, and poor diet. These are the main cause of females get the osteoporosis, because when they get the menopause after 30 to 45, after that age, you have the hormones, estrogen level of the hormones is reduced in the body, and that's how the hormonal imbalance happen in the female body, and that's going to affect the bone density, and then you get the osteoporosis. In male, testosterone hormones gonna low down, and then it's gonna affect the bone density also. So these other many reasons. It could be inherent also. You family, maybe in your family, mm, people are having, you have the family history of the osteoporosis, and same with the arthritis. Arthritis is the inflammation of the joint. Osteoporosis, where the thickness is reduced of the bone. Even by coughing, you get the fracture. That's problem, and you never, you cannot see from the outside. When the fracture happened to the body, then the doctor, diagnosed, oh, that person is suffering from the osteoporosis. That man is suffering from the osteoporosis. Even slightly, you just maybe you're walking and slightly you twist, your bone gonna fracture. So that is the osteoporosis. And many people get even just by coughing. They cough a lot, they coughing it, and they get the fracture. So it can be a chance, but it's rare. It's like when the osteoporosis is aggravated like so much, and that is the higher condition, aggravate condition of the patient, where if he's coughing, he got the fracture. That is a very risky, very aggravate situation. But even in the normal situation, you're walking, you are climbing the stairs, you can get the fracture easily. But normally, if there's a healthy bone, thickness of the density of the bones is maintained, you don't get the fracture easily. Your body's ligaments, your muscles gonna support those bones mobility, and provide from and prevent from the twisting and giving you the fracture. So this is the osteoporosis. Causes, many other causes are also. I'll talk about the risk factor is this. Prevention we're gonna talk about all together. Now arthritis, the inflammation of the bones. Osteo basically is the French word, which means also the bone. And arthritis also, which means the inflammation of the bones. What happened in this situation? The joints. So you have the joints. This is the joints, right? Wrist joint, elbow joint, this neck joint, which you move, your ankle joint, your knee joint. These are the joints, and we have the name of the joints. This is a pivot joint. Because of that, you can move your neck left to the right, right? And then even your finger, in this, you have the joint. Why you move your finger like that? You have the joints. It's called synovial joint. Okay, synovial joint. This synovial joint's gonna inflamed. So two types of the arthritis is there: rheumatoid arthritis and osteoarthritis. Osteoarthritis is happened because of the cartilage is inflamed. What is a cartilage? Have you heard about cartilage? So cartilage is a kind of cushion. So for example, I have the joint here, right? And this flexion and extension, I'm doing it with my elbow. So I'm moving this, my hand. So this joint, when two bones are joined together, for example, these are the two bones, right? Okay, this is the two bones you are having it. So between there is a slightly cushion. So maybe you can use, for example, this is a phone, is a cushion. Slightly you can put the cushion between these two bones. So this in between structure, a pillow kind of structure called cartilage, that called hyaline cartilage. Don't go into the names, okay? There's anatomical names, but understand, when two bones are joined together, there's a cushion provided by the cartilage. When you move, you jump, you climb, so shock would be absorbed by this cushion, this hyaline cartilage. But what happened when you got osteoarthritis? This cartilage is inflamed. This cartilage is gonna become thin. Either become thin because of the lack of the oxygen in your body, poor diet or stress, and poor your posture, um, or day-to-day activity, whatever activity, or sitting for the longer period of time, and no mobility in your cartilage. It's gonna weaken your cartilage or thin your cartilage. And when you move, then because of the lack of the blood circulation of those area, your muscles, your ligaments gonna weaken also. And then you get the inflammation around your knee, around your hands, around your wrist, in your elbow, and their fingers. I don't know, have you seen any arthritis patient? So painful. Their hands become like this, like this. They cannot, hold. If they want to hold like this, they cannot hold. They cannot um, keep anything in their hand, and they cannot walk properly. This is aggravate situation of the arthritis patient. Very painful. So you cannot cure it. There's not fully cured available, but research is still going on. Maybe Ayurveda, but in yes, allopathic, there is no cure for the even osteoporosis, no cure for the arthritis, no cure for the rheumatoid arthritis. In rheumatoid arthritis, second types of the arthritis, what happened is genetic. Your autoimmune disease. It is autoimmune disease, which means your white blood cells is attacking because of the wrong information, wrong signals given by your joints. So your immune system gonna attack your all the joints, and then your because of attack, the around that area, the joints area, gonna inflamed. So it's mostly attacked happen in your synovial area, synovial membranes. What these are. So you have the cushion that is called cartilage. Now, I'll give you the one example so maybe you understand that thing. When you jump from the top 20 floor storage building, jumping from the ground, what happened? You're gonna break more, your body parts. And same, height, you're gonna jump to the pool. What happened? Yes, again you're gonna hurt, but less, because shock is absorbed by the water, the liquid. Same thing, it's happen with your joints. So joints, these two bones, there's in between huge gap. There's a cushion in between, and there's a synovial fluid. Synovial fluid. So for example, this is a two joints, and in between there is a cartilage, and around them there is a synovial fluid. I'll show you the pictures of those things so you get the better understanding. I'll show you on the WhatsApp, but I don't know right now I can. It's very difficult to share because then we lose the quality of the audio. I'll share you on the WhatsApp. You can understand in that way, better way. So what happened? There's a fluid also, a water kind of liquid, lubricant. When you jump, it absorbs the shock. So that's called synovial fluid. Synovial fluids connected by the synovial membranes. So these area affected, these area attacked by your immune system or somehow inflamed because of another reason, and you got rheumatoid especially in allopathic. So this is the arthritis and osteoporosis. Any doubt till here? Good, everybody is understand. Next, disc herniated issues, right? In disc herniated problems, you have the spine, the vertebrae column, right? You have the 33 vertebrae column, and every vertebrae you have the disc. So disc herniation, it means disc bulge out. Simple language, simple layman language. disc bulge out. So what happened? You have the vertebrae, 33 vertebrae, each like this much in your spine. You can even touch. You can even feel the gap in your spine, right? So each vertebrae having the again the cushion kind of cartilage. That is not the hyaline cartilage. That is a different cartilage. You are having it, okay? Um, so that cartilage give you the cushion again. In between the each vertebrae, there is a cushion between, and then because of the wrong posture, for example, you are sitting like this. This is the posture, and you sit like this. You make the hunch. So what happened? Wrong pressure come to the each vertebrae. You're shifting the wrong pressure to the lower vertebrae, and so the disc bulge out. That cushion bulge out, or maybe because of certain injury, you fall somewhere, you met with the accident, or maybe you are jumping, or because of the too much cycling. Because in cycling we do like this, right? We hand like that and we cycle like paddling the cycle like that. So again, that is the wrong pressure coming to your back also. And the whole day you are sitting on the decks. That's also lack of the exercise, lack of the mobility of your spine. So due to these factors, you get the disc herniation. And disc herniation happen in two, places. One, the neck, and second is lower back, L4, L5 region. This is the main area when the disc bulge out or herniated. Herniated means bulge out. And there's other types, there's other deformation of the disc also, but we are talking about the only the one, disc herniation. So for example, this is your disc and in between there is a cushion. It's a little bit slightly bulge out. And then it's pressing the nerve. It's gonna press the nerve around. It could be a sciatica nerve. Have you heard about sciatica nerve, which passing from your hip? It coming from your lower lumbar region. I don't know all of you did the anatomy or not. If you don't, so go through the little bit Google area and slightly study about these things. Okay, little bit knowledge you should have the anatomy. And so spine, in your spine, there's a spinal cord where all the cords of the brains are going. There's a many nerves passing from your spinal cord and going in your arms, legs, and rest of the body parts. Okay, so there's a one nerve that called sciatica nerve, and there's a many issues related to the sciatica. Sciatica problems like a long nerve of the leg, and then that sciatica nerve later on go towards these nerves give what nourishment, blood circulation, and other things to the whole organs, whole part of the body. So these nerves, the one of the nerve which is the longest nerve of your body, that is a sciatica nerve, which coming out from your lower lumbar region and passing through your whole leg. And when you get disc herniation in your lower lumbar, you get the problem of the sciatica problem, which means the problem is happening in your disc, problem is happening in your lower, the spine, and it's going to affect your leg. Any problem, spinal disorder, any kind of spinal spondylitis, right? If you have the neck issue, so maybe you heard about it. The arms, you feel the pain in your arms, you feel the pain in your fingers, you feel the tingling sensation, numbness, and another kind of like ant is crawling, these kind of sensation you feel in your legs and in your arms. If you get the problem here, you feel the problems in your arms. If you get in your lower lumbar, you feel the problems in your leg, one of the leg giving. And when you change the position, the pain reduced. But again, if you're sitting for longer period of time, you get the problems. Pain is very sharp and too much pain. So burning, it gives you the burning sensation and burning pain to your hip, to your leg, if the disc herniation happen in your lower back. Later on, if it's become aggravated, then you get the bowel dysfunctional and the urine dysfunctional. It means you cannot control your bowel. You get the frequency of the urine and frequency of the bowel also. So these are the aggravated condition of the patient. So disc herniation and arthritis and osteoporosis, you understand, and these things create the back pain. Either you have, and also the muscles weakness also create the back pain. Tenderness of the muscles also create the back pain. So reason could be any. These are non-factor also. Maybe you are having the proper diet, but because of the lack of the sleep or too much work and intake of the alcohol, tobacco, maybe that is the reason you get these problems, because these problems reduce the oxygen level in the body. And when the oxygen level is drop out, you get the cells degeneration. So you get the osteoporosis. There is a high chance when there is a lack of the oxygen, you get the arthritis also. And disc herniation also, because the disc also, alive and healthy by having the high blood circulation there. But if you have the lack of the oxygen in your body, the blood circulation is reduced, and so they gradually gonna degenerate it. So it could be the reason. So if you're having the alcohol or tobacco or a poor diet, it could be this reason also. And long time, what kind of occupation you are doing it, that's also gonna affect these conditions. These are the conditions is dominant in the body. The problem is clear. Any doubt till here? Tomorrow we're gonna talk about problems. Okay, Vata related issues, how we can control the Vata related problems, general problems. Though there's a individual therapy for everything individually, but we're gonna talk about the general approach and find out the cure for these 4 problems. Any doubt till here? Very well, good. So we're gonna end our session with the one-time Om and Shanti Shanti. Keep your back neck straight. Bring the alignment. Take a deep breath. Exhale. Inhale and exhale. Now inhale for the one-time Om and Shanti. Shanti, Shanti, Shanti. Join your both palm, rub your palm, place on your eyes, feel the warmth. Very slowly while blinking, looking at your palm, gently open up your eyes. Say Om Shanti. Namaskaram, Om Shanti. Bless you guys. and meet you at the pranayam class. Bye bye. Take care.
Om Shanti. Thank you.